bone fracture is a crack or a break in bone. They usually result from high force impacts. But people with osteoporosis, bone cancer, and old people experience fractures with very little impact because of fragile and brittle nature of their bones. A fracture is referred to as Bhagna in Ayurveda. Normally, a fracture can be classified under two types. Number one, simple fractures. It's when the bone breaks into two but doesn't pierce the skin. In such cases, the bone isn't exposed to the air. Number two, compound fractures. It's kind of a bit serious condition. In here, the break causes the bone to pierce through the skin. Ayurveda explains fractures or Bhagna as a break in the continuous structure of the bones, resulting in its lack of motion. A break in the bone can be a dislocation, also called Sandhi Mukta, or a fracture, also called Kunda Bhagna. Ayurvedic scriptures describe at least 12 types of dislocations and 6 types of fractures. The Ayurvedic treatment for fracture is hence distinct for each type. When a person experiences a fall or met with an accident, like getting hit by a car or a sports injury, the injury could be a sprain, a tear, a tissue injury, or a fracture. The condition could be any of the above. The symptoms of a fracture are well known. The excruciating pain, excessive swelling, and the immobility. Ayurvedic treatment recommends placing the suspected body part completely immobile and tying it securely with a clean cloth or a bandage. After that, the patient must be immediately taken to an Ayurvedic doctor for proper treatments. If the patient mistakes a fracture for a soft tissue injury and tries to self-treat it, the condition would worsen. Some patients use the aid of an ice pack to reduce pain. Even this is not recommended. In Ayurveda and Indigenous medicine, we strongly advise against the use of an ice pack on a fracture, as we believe it could tighten the muscles around the fracture and aggravate the condition. Upon consultation with the patient, an X-ray is prescribed. Depending on the X-ray, the condition of the injury is diagnosed, and if it's a multi-fracture, Ayurvedic treatments are not suitable as it demands surgical treatments. Plaster of Paris cast is your usual fracture first aid, but in Ayurveda, the treatment methods are completely different. Your doctor will first diagnose your condition by evaluating the appearance of the location. Then the doctor will decide the type of fracture or dislocation by using touch and feel approach to confirm the diagnosis. Some Ayurvedic doctors will put a pattua on the fractured area and wrap it tightly with a bandage. A pattua is an Ayurvedic paste made of bone healing herbs. The herbs are mixed and ground into a paste. The paste has a therapeutic effect that helps the merging of the broken bones by inducing calcium production, and it also heals damaged or ruptured capillaries around the fractured area. But the downside of this is it takes months to heal. So to counter it and help the patient recover way faster, we use an organic oil made of all the great herbs that help heal fractures. This oil is 10 times more effective than a pattuva. We use that oil to massage or mend the fractured area, and after that we do a fermentation therapy using a bolus made of ground seeds. First we have to heat the bolus with steam. After that we gently ferment the fractured area. The mending process should be done by an experienced veteran. Even most of the Ayurvedic doctors don't believe in this method because most of them are too scared to touch a fracture and they lack the skill set to do it without making the condition worse. Using this mending method, a patient with a hairline fracture can be fully healed after 3-4 sessions. After the mending process and the fermentation therapy, we usually cover the fractured area with cotton wool soaked in that herbal oil, and then we put an oil paper or a betel leaf over it to reduce the spilling and to prevent the oil absorbing into the bandage. Then we tightly bandage it. You have to keep the bandage for 48 hours, and it is recommended to keep it dry. After the fracture and the damaged tissues around the fracture are fully healed, physiotherapy exercises should be done to gain back the lost mobility. Heavy exercises are not encouraged, but after complete recovery, the patient can do whatever they want. If you liked what you heard, please like, share and subscribe. And if you didn't like what you heard, I thank you for listening this long. In our next video, we'll talk about anemia. Thanks.